Something shifted during the pandemic. Maybe it was your energy, maybe it was your sleep, maybe you just stopped bouncing back the way that you used to. And no matter what you've tried, you can't seem to get back to where you were. But maybe it didn't start with the pandemic at all. Maybe you've been dealing with fatigue and inflammation, autoimmune issues, or just a general sense that something is off. And every time you see the doctor, they tell you, you're normal. All the tests come back normal. If this sounds familiar, this episode is for you. My guest today is Dr. Jess Armine, a healthcare provider with over 50 years of experience across emergency medicine, the U.S. Army, chiropractic, and functional medicine. He holds one of the first certifications in neuroendoimmunology, which is the study of how your nervous system and your hormones and your immune system all work together. And he has spent decades asking the questions that most doctors don't have time for, which is, why are people still feeling sick even when the tests come back normal? In this episode, we walk through the entire picture: the cell danger response, mitochondrial dysfunction, leaky gut syndrome, the spike protein, and a step-by-step protocol for how to actually heal your foundation. It's not about managing symptoms. It's about truly healing the foundation so that you can thrive. This is one of those episodes that I think could genuinely impact and change your health. So get comfortable, grab a notepad to take notes, and let's get into it. Welcome, Dr. Jess.
Howdy.
Why don't you just give us a little bit of who you are and essentially why people might want to listen to what you have to say?
Okay. I started from being Sicilian from Brooklyn. I've been a healthcare provider of one form or another for 50 years. I have an eclectic background. I started out as a ENT paramedic in New York City. And then I went to college for nursing. I graduated in 1978. Did 4 years in the military as an Army nurse. Did mostly emergency and critical care nursing. Then I decided that I wanted to be a physician. And I did all my prep for medical school. But I met a lot of medical doctors who really didn't like what they were doing. And I met a lot of chiropractors who loved what they were doing. So I went to chiropractic school. I graduated that in 1986. So by the time I was practicing your standard chiropractic that you mostly understand when you're up there with musculoskeletal problems. But honestly, I found that to be a bit limiting for me. And I had a lot of interest in old alternative medicine, especially when I had the background in both areas. So I started delving into that. One of my children developed a mental illness. And this very intelligent young man was turned into a non-entity by his medications. And I decided that disease was messing with the wrong daddy. And I started diving into everything I could learn. Spirit, you're ready to learn something. All of a sudden, all of this information, all the courses and everything are thrown right in front of you. I learned how to balance neurotransmitters for mood disorders. I got the very first certification in neuroendoimmunology, which is the relationship between the nervous system, the hormone system, and the immune system. And that's how we maintain homeostasis, how we balance ourselves. I was at the forefront of a genetic craze that's running around now, where people are still complaining about MTHFR, and my nemesis, But I was the one that created most of the programs where you were looking at the entirety of the genetics within the pathways. Dr. Ben Lynch has one, and actually I created it, gave it to him because he had money, I didn't. So he developed it, did a good job. So I learned after a while, I started treating people for lots of different things. And I noticed that there were a lot of people out there who were told that everything's okay. It's just in your head. All the tests are normal.
Yeah.
So it must be you. And they were still suffering. I have diplomates in forensic medicine as well. So I can tell you that the amount of people who are malingering in my entire career, I can count almost in one hand. But when
The amount of people that what?
That were actually malingering, displaying illnesses that weren't there. I could count on
malingering. Okay, I don't think I knew that term before.
These people are really suffering.
Real is happening.
Something real is happening. There's always that, we don't think it's this because the studies don't say that. This I understand. But when I started looking at things like pandas, which is pediatric autoimmune disease secondary to strep. And children will get strep throat and go psychotic.
Oh
And
my
when you
God.
treated the strep, yeah, that's what Pandis is. Dr. Trifoletti did a little research on it, but when Pandis was pediatric secondary to strep, I was like, there's going to be more and different microorganisms can cause changes in the neurological connections and the neurotransmitter balances and so forth. There's pretty lot of stuff together. And I was saying to myself, gee, why are these people still ill? Like, they're not lying to me. You know, why would you pay me, okay, independently to lie to me? You're not going to. So that's out the window. And over time, I realized there was this one big area that was not being considered. And that was the foundation of the body itself, the cellular foundation. The thought is in traditional medicine is that if I take care of the root cause, strep throat, that kind of stuff, the body will take care of itself. That's okay for an acute condition, but not a chronic condition. And most people I deal with have long-term chronic multifactorial conditions.
Ah.
And what happens is they get whatever these conditions are that damage their cells, and those express as whatever the symptoms are. Okay, so you have the root causes, you have the damage to the cells and downstream effects. And they were treated for some things, but mostly symptomatic treatment, which, by the way, is not
Symptomatic
bad.
treatment, which is the classic way that Western medicine functions, right? The way doctors are taught is basically treating the symptoms as opposed to looking at what's causing the disorder or disease.
That's true, but mostly in the neuropsychiatric realm,
Yep.
fatigue, fibromyalgia, things that are a little bit more amorphous. Obviously, if you have an infection, hopefully they do a culture, they're going to say, okay, let's treat that. Okay. Remember, my medical colleagues are not stupid and they really do care, but there's this glitch that people have these conditions, like I said, fibromyalgia or MECFS or whatever it happens to be, that doesn't lend itself to a single diagnosis. And most diagnoses, especially in the neuropsychiatric realm, are not diagnoses. If you have a sore throat, that is a symptom. If you have strep throat, I know why you have sore throat. Okay. If you have OCD, that's a list of symptoms. It doesn't tell me where it comes from. If your child has autism, the list of symptoms doesn't tell me where it's coming from. Now, even worse, because there was no marrying up of root causes and these symptoms, especially, like I said, in the neuropsychiatric realm, what ended up happening was, oh, it's a roll of the cosmic dice. Stinks to beat them. Or exaggerating it and so forth. They didn't believe that there were reasons for it. And I see this a lot in autism, just a roll of the cosmic dice. Well, let me put it to you this way. In 1970, 1 in 10,000 births, you had an autistic child. Now it's 1 in 34.
Yeah, it's absolutely mind-boggling to consider that huge difference.
Think about it. It's always genetic. But honestly,
How could that explain it?
your genes have not changed since time immemorial. This is a BC body in AD time. So if it's not your genes, what is it? Environment, infection, inflammation, toxins, and so forth. There is no one reason. It's the vaccines. I know. Okay, but what was the difference in vaccines? I was 69 years old when I was a kid, a long time ago in a galaxy far away. All right. Maybe there were 3 or 4 immunizations. Now, what are they, like 72? Some ridiculous.
I think you're right, 72.
And babies are getting immunizations in the hospital when their immune system is not even working.
I think one thing that I don't think a lot of people look at is that there are inserts for every vaccine. And if you read that, you'd be pretty alarmed to see all the potential side effects that are not really being discussed in these visits.
I've had a lot of parents who have an autistic child that I was treating, and then they have another baby, and they don't want this to happen again. So they usually find a doctor, and I stimulate them to do this and to get the basic immunizations, but spread them out. And the next child does not become autistic. And they have basically the same genetic profile. So
Yeah.
that's just talking immunizations. We have all kinds of other toxins in our atmosphere and
Sure.
exposed to GMO foods and stuff like that. It's the accumulation of it all.
Yes.
There was a doctor, Robert Nabio, who in 2013 wrote a paper on the cell danger response, which is how your cells respond to an attack. He quantified that three things basically do this: toxins. I don't think anybody's going to argue about that, right? Microbes, parasites, yada, yada. And all the psychological, spiritual, and emotional traumas.
Yes,
Okay.
which I don't think until recently has been explored particularly well.
It hasn't. But when you dig into the literature, and you have to dig, you find out there are studies that show that people with depression, people with anxiety, they say in a funny way, support pro-inflammatory cytokine creation, which means support inflammation. Okay. 1936, Hanselier said, oh, somebody who's depressed gets colds more easily. So there's a relationship there.
Yeah.
It's just been food. And in this time frame, since the pandemic, we're running into issues with the spike protein. That is a protein from COVID or the immunizations or from shedding that takes your receptors, these two receptors, and it looks like a little spike. It sits there and makes the receptor dysfunctional. Those receptors are all in your body.
Yeah.
And we're finding that with this particular issue, that people are getting sicker quicker. They're getting more lung problems, more heart problems, more infertility issues.
Cancers too, right? Haven't we seen a surge in cancer?
Yes, we have, especially younger people.
Yeah, which is very strange.
It is very strange. But if you think about what this is doing, okay, let me go back to the cell danger response. When you have an assault on a cell, okay, what the cell does is it closes off, it makes the inside more toxic to the bug, let's say, okay, and it doesn't let you get rid of the toxic metals and messes with methylation, and it releases hypochlorous acid, HCl, which is an antimicrobial agent created by your body to kill this thing. And it does that until the danger is over. Now, then we have this whole set of mechanisms that reboot the cellular function. What does this look like? Going back to strep throat. Okay, you get strep throat. You feel terrible. Go to see your doctor. Give you some antibiotics. All right. First day or so, well, okay, but then you should start getting a little bit better. Then there's a day you turn the corner and you get better rapidly. That's where the cell danger response has resolved. And all of a sudden, everything just starts working again. This all has to do with the mitochondria, by the way, your energy production. When this happens numerous times, or one factor keeps on going, the cell danger response does not resolve and ends up in cellular dysfunction, specifically mitochondrial dysfunction. What does that have to do with the pressed potatoes? The mitochondria are those little organelles in your cells that produce energy. For those scientifically minded modelers, it's ATP or adenosine triphosphate, but it's energy.
Yeah.
I'll give you an idea of how many mitochondria you have. You have 30 trillion cells and roughly between 200 and 2,000 mitochondria per cell. You do the math.
Wow.
Okay. So it's not really all or wrong. It's more percentage. So let's say you're real healthy. You're probably pumping out about 95% of what you can pump out. That's normal. Okay. You get something like strep throat, it'll probably knock it down to 80%. Okay, but what it resolves goes back up to 90, 95%. In reality, when you have chronic illness, that mitochondrial function may go down to like 70%, 65%, that area, and stay there.
It stays there.
That's where your fatigue, that's where your fibromyalgia, that's where your aches come in. And you said, I'm just getting old, okay? The spike protein came out with COVID, and it's been occupying, it's now considered a toxin. It's occupying the ACE2 receptors. And what that's doing is taking that percentage of energy production, knocking it down to 50 and keeping it there.
Yikes.
So when you have a lot of oxidative stress, chronic inflammation, oxidative stress, same thing, right? And normally you're up at 85, 95%. You can compensate for it. Okay. You can
Your
fight it.
body can take care of it because ultimately we are
Exactly.
designed to heal, right? We give
Exactly.
ourselves the right things that we need for
Right.
nutrients, rest, and exercise, and all that good stuff. Yeah.
Absolutely correct. But this has been the bane of a lot of people's existence because not only from the immunizations or COVID itself, also people are shedding.
Yeah, I have a question about that. So if you didn't get the immunization, but you did get COVID, is it different because you've acquired it in the way you would normally acquire a virus versus having something injected into your system? Or does it not matter when it comes to the
Doesn't
spike
matter.
protein?
Okay. We call it the vax spike, vaccination spike.
Yeah.
Is much more powerful, okay, than the COVID spike. Nevertheless, it does damage, and no damage is irreversible. Okay,
Right.
so the whole idea here is to understand that this is what's giving rise to what people are now calling long COVID, long whole COVID, post-vaccination syndrome. Let me be cynical about a minute. Okay. How do you know this is an issue? Logic will suffice. If you were ill before the pandemic and you became more ill
Yep.
and you never got back to your baseline, even though you were ill, you never got back to where you were, that's the spike protein.
Okay.
If you were not showing symptoms, you were not ill, you're a really good, healthy person. Okay. And you either had the immunizations and or COVID and or people around you shed all of you.
Yep.
Okay. And you got ill or your energy started flagging, anything that's not you. Okay. And you never got back to where you were before the pandemic. That's the spike protein. There are some tests you can do. There's some antibody tests. And there's a new test called the UST, urine spike tracing, which is a urine test that can actually test for the spike proteins in the urine, because they actually find those. Nevertheless, this is adding to the chronic illness scenario that has gone around these days.
And there's another factor that concerns me because I did not get the vaccine. I did enough education I've been reading about vaccines for 35 years. And I just felt like it was too new and untested, and I was not willing to take the risk. I got a very mild case of COVID, as did my husband. And he lost a little bit of his smell abilities, which still haven't completely returned. But one thing that concerns me, because I was thinking about ways to test for spike proteins, because he's given blood a lot over the years because he's got type O, which is the universal blood type. And the last time he gave blood, they actually screened for the spike protein or
The spike antibodies.
spike antibodies. Thank you. The thing that concerns me too about all of this is if somebody required a blood transfusion, it does not seem that they are screening out for spike protein in the blood supply.
Yeah.
So that concerns me.
This happened with AIDS before, okay, that
Yes.
they weren't screening. It's too new and they're not recognizing the significance of it.
Exactly.
The bigger issue here is you notice that we live in kind of a chronic illness society. Have you had anybody that just doesn't have a chronic illness? Okay.
Thankfully,
And
but
yeah, no, really, yeah. There's always exceptions to every rule.
yeah.
Mhm.
And I make it my life's work to live the least toxic, healthiest life I can possibly do with the things that
You're
I can
doing
control.
well.
Thank you.
Here's the thing. I've been around so long. I saw this happen where there was a shift towards more expensive medicines, more expensive testing and stuff like that. And you begin to wonder, how come people are getting sicker? They're getting sicker.
They are getting sicker,
Okay?
correct?
They're
Yes.
getting sicker, generally
Even with
speaking.
all the testing and whatnot. Yeah.
Exactly. And then, of course, you have things like rheumatoid arthritis, autoimmune diseases, Hashimoto's thyroiditis.
Oh my gosh, so many.
Autoimmune disease, oh, it really stinks to be you, and your body's attacking itself. It's probably genetic. How come it wasn't there when you were a baby? Yeah, look at them straight in the face. How come it wasn't there when you were a baby? Why is it happening now? Okay, all of it has to do with oxidative stress and chronic inflammation. I'll take fibromyalgia as an example. Fibromyalgia used to be a diagnosis of exclusion, which meant Your doctor would do every test in creation, make sure it's not your thyroid, liver, that. And then if they just couldn't find anything, you still had the pains, they call it fibromyalgia.
Oh, so it was
And
just kind of a catch-all for unexplained pain?
yeah, for a certain set of symptoms. Okay.
Okay.
But they did all the work. So if it was a thyroid problem, you were treating it. If it was something else, you were treating it. Nevertheless, the American College on Rheumatology came out with this little chart saying if you have pain here and here, you have fibromyalgia. All of a sudden, everybody had fibromyalgia. Why? Because it was easy to diagnose.
Yeah.
They weren't doing the other tests. They weren't looking for root causes. Why?
Huh.
Because Lyrica came out. Okay.
Is that a drug?
Yeah, it is. And it was specific from fibromyalgia. Same thing for the autoimmune diseases. They start out with anti-inflammatories and they build themselves up to COX-2 inhibitors, then build themselves up to steroids. And then from there on in, you start getting to the biologics. You see them on TV. You look at everybody's having a good time dancing around. Close your eyes and listen to what they're saying.
Yes. Oh my God. I talk about this
People
all the
have
time.
died. Yeah, people
It's totally discordant, right? You see the happy
Right.
people, dogs, the kids, and then you listen, may cause stroke, death, blah, blah. I'm like, oh, wait, what?
It may not fight infection because what they're doing is damping down your immune system.
Ooh,
Okay,
which seems
because they're telling you
counterproductive.
that it is very much. Over
Which
the
is the
years,
same kind of thing for treating cancer a lot of times, right? When they give chemo, it's killing the body, but
right? As
supposedly
well
it's
as
just killing it to a certain extent.
what they're doing there is they're giving you a poison, and because the cancer cells rapidly reproduce, they're hoping that takes it up first. But as you notice, it kills off your stomach lining because those cells reproduce in 4 days. Your hair falls out because that's rapidly reproducing cells and so forth. But I started looking at it more generally, and I realized that, and I hate to be cynical, but I think this to be true, that there's more money in treating cancer than curing cancer.
I think so.
There's more money in treating diabetes than there is in curing diabetes.
Yeah.
And I've seen these things with different conditions, if you will. And then they're looking for common root causes. In other words, not only what creates a cell danger response, but what maintains it. And long COVID is becoming the same thing now.
Yeah.
There are no treatments. There are no treatments. So we're just going to let this hang out for a while. And people who we're going to identify that have long COVID are people who are going to be suffering. And after a little while, you'll see some medicines come out that will manage the chronic condition, cure it. There's a real difference because when you don't cure it, whatever the base pathology is allowed to continue. And I hate to be like that, but you know something?
But I think that's what the facts seem to be showing.
Exactly.
Yeah. So shifting to a little bit more hopeful, how are you helping people that come to you with long COVID and other things like this?
Okay. There's some basic things that I always look for. First of all, I take a really good history. My intakes take about 90 minutes. And I do it myself because unfortunately my medical colleagues don't have the time. They're forced into this, by the way. It's not because they want to. They don't have the time to do this kind of work.
Is that largely because of the insurance companies or something else?
Yeah.
Insurance companies.
Medicine became corporatized.
Yeah.
Okay. And when it became corporatized, as corporations want, they want productivity. So they give you all kinds of support, but they limit the doctors to 10, maybe 15 minutes a patient, where if you're lucky, you can deal with just the chief complaint. And within that time, they're saying, okay, but we're getting some statins and so forth. Have you had your immunizations? They're forced to do this stuff. They're forced to push it on you, okay? Because they're corporatized. Just think about this.
Yeah, that's really
You go to college, right?
Yes.
You graduate college if you're lucky enough to get into medical school. And then at the end of medical school, you're going to do a year of transitional internship and then decide maybe on a specialty. And if it's a medical specialty like internal medicine, it's 3 years. But if it's a surgical thing, it's going to be 6 years. And if it's a surgical subspecialty like cardiothoracic surgery, it's going to be 3 years of cardiology, 6 years of general surgery, and another 3 years of specialized cardiothoracic surgery. The reason I know this is because my last duty station was at Fort Dix, New Jersey, and Deborah Hart Lung Center was right next door. I got to know a bunch of the docs there. And they weren't even getting out until they were like 30 something. Now they start
And the
working.
amount of debt that they must have to
Oh my God.
deal
Then
with
they
as
start
well.
working. The corporations that own the practices, they'll pay for your malpractice insurance. They'll pay your lungs. Okay. They'll pay you as long as you toe the line. They don't say it that way, but as long as you toe the line. So here's this poor guy or gal. Now they're starting a family, they get a house and so forth. And this is worse in England, by the way. They're basically told that if you don't toe the line, you're going to lose everything. You'll get struck from the records. In the old HMOs, if you got kicked out of the network because you were giving too much services to your patients, you got kicked out of, let's say, I'm not going to name insurance companies, but then you got kicked out of Medicare too, and Medicaid, in which case
So you couldn't practice.
you could. When I went from an insurance practice to a cash practice, you had to be able to live on 30% of your income. Okay. 30% of your income, because most people treat with their insurance, rightfully, but the services available have been, we have it all taken care of. You go to a hospital, you stay a day, $10,000, $12,000. Oh my gosh. And wow. And I know they're not getting that because the insurance companies have negotiated everything. Nevertheless, when I work with somebody, I was telling everybody before that there's this one area that I noticed is never being treated, not being treated accurately. And that's the foundation of the body, which is the cellular structure and what creates inflammation, which is usually leaky gut syndrome. Okay. You may see it as terrain treatment these days, or
Say that
bioterrain.
again. As what?
You might see it as
terrain.
treatment. Terrain. I invented it way back when. Okay. I give out the information. They laughed at me for years. Okay. Now all of a sudden everybody's doing it. And of course they're writing books, putting different names on it. I don't care. Okay. I just wanted to do it because what was happening after you had something for a long time is that downstream of it, you had some dysfunction or lack of what you needed. So if it happens to be, let's say, serotonin in your nerves, usually you're given a serotonin reuptake inhibitor, which prevents some of the reabsorption and maintains the serotonin level. But if you're not producing it, it's going to fail.
Yeah.
And those medicines don't think about production. They don't think about manufacture.
Replacing what your body should be doing.
They're not really replacing it.
Not even replacing.
They're actually fooling your body. They're saying, okay, I want to have more serotonin in the synapse between the nerves.
Okay.
So when you release serotonin to carry a message across, once it gets off the receptors, it either just hangs out or it gets broken down or it gets reabsorbed for reuse.
Okay.
So I'm going to prevent some of that reabsorption so that the amount of serotonin in that space is maintained. But you still have to produce it because it's not going to stay there forever. It's a dynamic system. It's going to get broken down, going to get fed. And eventually, if you don't have it, you don't have it. You can't. Okay. You just
manufacture it anymore.
Can't manufacture it. So what prevents you from manufacturing it? You can't break down your foods. I see this a leaky gut all the time. Okay. You can't break down your food. So instead of this nice protein that you're breaking down to the amino acids, you're breaking it down to the short chain proteins, which are antigens. They're the attackers, right? And that between the toxins and all that yada, yada, it damages the gut. Once the gut starts getting damaged, it actually creates little spaces in there where those antigens can get through. And then the immune system works on it. And the result of that is inflammation. And that builds and builds. And over time, what I've noticed is that you go from food intolerances to immune dysfunction to autoimmunity to neuroautoimmunity to dysautonomia, things like POTS and so forth.
Quite a slippery slope.
It is because it's all a matter of the amount of inflammation coupled with genetic predisposition. But the base of it all is at the cellular level. So just like you said before, if you can give your body what it needs, it's a perfect machine. It will start rebuilding itself. But that's the glitch. Give it what it needs.
And I remember from our last conversation, if I recall correctly, you basically said that people should assume that they have leaky gut and do the steps accordingly to make sure that gets healed.
Right.
Do you want to talk about what those steps
Sure.
were a little bit again?
I'll do that and then I'll talk about the long COVID.
Oh, yes. Yeah.
First off, your biochemical processes are not going to work unless there are vitamins and minerals in the cell, because that's what Both factors are the biochemical processes. Again, all of this is a matter of absorption. So when you go to the local pharmacy and you get this tablet, you say, oh, it's multivitamin. Most of it doesn't get absorbed. Okay. If you want to really absorb it, you have to get intravenous, but that's expensive and not readily available. The next best way of getting it is liposomal vitamin, liposomal.
Yep.
And they're readily available in Amazon, places like that.
Yep.
And those are guaranteed to get into your cells. And the next level of absorption is liquids, then powders, then capsules, and then tablets. Okay. So I'm always recommending to people that they should take liposomal multivitamins because I know it's going to get in.
Yep.
The parameters of leaky gut syndrome, the way you fix it is number one, you got to have to digest your food good. Okay. So you need to look for a digestive enzyme and look for the words amylase, protease, okay, because that means you're breaking down protein and carbohydrate and fats. Okay. And take one with each meal, to help your digestion. In the gut, you need a mucus layer. That's what traps everything. And then you want the cells to get back together. A mucus layer is made from fibers. Prebiotics, that's what those are. Okay. But when you have a probiotic that has some prebiotic in it, don't be fooled because there's not enough in there to recreate your mucus layer. There's enough in there to maintain it, but not recreate it. It's just not enough. Okay. I'll send you this poster I did on the fibers, where you can look at it, because it's acacia fiber and nutriose and PHGG and opinion.
Oh, that's right. I remember you mentioned the acacia fiber was one of the better ones.
It's the one that has the least reactivity. Okay.
A powder that you can mix with water.
But they're all powders.
They're all powders. Okay.
The easiest thing is to use the powders because you can get a fair amount in with just some water. It doesn't have to be water. It could be juice. It could be whatever you like. Yeah. You just throw it in.
Yep.
Usually people will use glutamine to help the cells heal.
Oh.
But if you have an anxiety problem or any kind of issue, you shouldn't use glutamine because that will create something called glutamate, which is very excitatory.
Oh.
And you might find that if you use glutamine, you're going to start getting more anxious.
Oh gosh, that's not good.
Yeah, you're right. It's not. But butyrate, okay, in the form of tributyrate, easy enough, just tributyrate in there.
Yes.
Okay. That's going to help your cells heal because that's what your cells need to heal. Okay.
So that's the alternative to glutamate.
Or you can use glutamine and that.
Glutamine.
Okay.
But if you have an anxiety condition, should you take both? Just don't use the glutamine.
Don't use the glutamate. Glutamate is an excitotoxin. And what happens with glutamate is supposed to convert to GABA, which is what calms you down. And if it has trouble in that conversion, okay, and there's an enzyme called glutamate peroxidase. Okay, if that's not working that well, you're going to have a rise in the glutamate.
Yeah. And it won't convert to the GABA?
Well, it will, but very slowly.
Yeah.
Very slowly, so that you're going to have this high amount of glutamate. If your mind runs, especially at night, that's glutamate. It's doing that.
Okay.
Glutamate gets high enough, you can have seizures. We don't want that. Yeah.
Okay.
Some people like to add zinc carnosine because that helps the cells adhere themselves together. And there's always an argument about probiotics, which is better, which is not.
Yeah.
If you're going to decide on probiotics, the easiest thing to do is to look for one that has a balance between the lactobacilli and the bifidobacteria. That's your basic microbiome. You can't go wrong with that. But if you use enough prebiotic, you probably don't need it because it's feeding your microbiome.
Because you already have that good bacteria in your system and you're just allowing it to flourish more by giving it the prebiotic.
Exactly. You start getting them more individualized depending on what the problems are. But that basic little program, and I'll give you another poster I did on the basic parameters of leaky gut syndrome. If that little program will usually start breaking down inflammation, depending on what's going on with you. But here's the thing about leaky gut. When leaky gut continues, you're going to have a lot of inflammation. So if you don't have leaky gut and I treat it, am I hurting you? Digestive enzymes create mucus? No, not. If you have leaky gut and I don't treat it, am I hurting you? Especially if I know.
Oh,
okay.
Yeah.
Or if I treat it partially, like I often see that. I treat leaky gut. I give us probiotics.
Oh my gosh.
Okay. Now, long COVID, I wrote a paper on this.
Okay.
That was published. N-acetylcysteine, NAC,
Oh yeah.
actually helps pull the spike protein off the receptors and chops it up. It's called denaturation. But Standard NAC doesn't work very well.
Oh,
There's a company out there that created Augmented NAC, which is a much more powerful form. They did in vitro studies, which means they went out and they bought tissues from labs, tissues that had COVID in them. And then they tested two things and they measured how much of the spike protein was denatured in a 24-hour period.
wow.
The standard NAC was about 12%, where the augmented NAC was 99%.
Holy smokes.
Yeah.
Is there just one of these augmented ones, or are there several to choose from?
That's only one company that makes it. If you go to augmentednac.com, that's where
Okay.
it'll be. Now,
Okay.
I'll be honest with you, it's a little bit on the pricey side.
Yeah.
It's very much worth it. Okay. Very
Yeah. If you have those kinds of issues that are getting any better, it certainly sounds like it would be worth it. Oh, okay.
Okay. That's what it looks like.
Cool.
Okay. Oh, by the way, this thing has a hellish sulfur
Smell?
smell. So when you get it, open it up, leave it out for a day. Let it
Oh,
dissipate.
wow.
Okay. But it's really sulfury.
Okay. Good to know.
But it works. It works very well.
Yeah.
There are other protocols for spike protein out there. Dr. McCullough's protocol.
I was just going to say Dr.
Okay.
McCullough.
He's the guy I wrote the paper with. Okay.
Oh, no kidding.
No kidding.
Oh, that's a big deal.
One of our thoughts was that if you use both, you get a better result.
Of the
augmented NAC in his protocol, the ultimate spike detox. Okay.
okay.
But he since came out with his ultimate NAC, which is standard NAC with a bunch of cofactors, which isn't nearly as powerful as the augmented NAC. I'm writing a paper on that now. Okay. The
Jeez.
comparison that's going to be published.
And do you think that the augmented NAC is enough for folks, or do they need other things that might be in the McCullough protocol?
The McCullough protocol, you have enzymes like that, kinase and stuff like that.
Yeah.
And some people use nicotine, has been shown to do that. But
Oh, yeah.
the
I've heard of-
substance that denatures the spike protein and pulls all three receptors that has been studied scientifically to have the best effect has been the augmented NAC. There's no question about it. Yeah, you can combine these, but some people have done both together. They get good results. Okay?
Yeah.
And some people have just done the one thing and they get
Augmented
good
NAC.
results. Yeah.
Okay.
It does take about 2 to 3 months to get rid of it, but there is a new test out called UST urine spike tracing. It's a urine test, and they can actually identify the spike protein in the test and the metabolites. That
Tells
partic-
you at what level those spike proteins are at in your system?
Yes. Okay.
Because that seems significant, right? Because if you only have a little
Right.
bit, maybe it's not as big a deal.
The most of the interpretation of those tests, people hire me for 15 minutes to explain it. The whole thing is that if you've done nothing and the level is low, but you have symptoms, it just means they're sitting in there. So let's say you got a moderate amount of spike protein, and then you start taking the augmented NAC, and let's say you're going to test again. You're going to see it go way up because what you're actually measuring is the amount of spike protein that's being chopped up and pulled away.
Oh, so
Go up and
once
up
you
and up
start
and up.
taking the augmented NAC, you will
It'll
see
go
an
up.
increase
You'll
initially.
see an increase in the numbers,
Ah,
okay? But you'll see a
Interesting.
decrease in symptoms.
ah,
Because what you're measuring is the spike protein itself, as opposed to an antibody to it. So you'll be able to say, okay, this is working because after a couple of months, it's going to start doing this. And you're going to say, okay, it's getting better. But then you correlate that with symptoms.
now
And
urine test, is that something that somebody can get to use at home, or do you have to go to a doctor for it?
yeah, actually, if you go to that website I just spoke of, you can order the test for yourself.
Oh,
Okay. And what they'll do is if you have a doctor that knows how to interpret it, that's fine. If not,
Yeah.
they'll send you over to me. And for, I think for a grand total of $25, I'll spend 15, 20 minutes with you going over it, put it into context.
Cool.
Okay.
okay.
So that's the way that works because I've been doing this for a long time and I understand how it works. I think it's more accurate. The problem is the reason you need to put it into context is because when you have something that's low, what does that really mean? I had one lady yesterday who was taking Augmented NAC 3 or 4 months and her number was low. So I said, if you really want to know, this is on your way down. Okay.
Yeah.
But if I saw that number and they hadn't taken Augmented NAC yet, I would probably sit there and go, if you're having symptoms, but when you take it, it's probably going to go up. But that just means you're chopping it up and throwing it out to the system to be excreted. Okay. It's all a matter of how you put it in context.
And what
Yes,
your levels were to begin with before you started doing anything.
agreed. So here's the thing that I want everybody to know about long COVID. And we could go into the exact reasons that the immunizations didn't work very well, the mRNA, and why they had so many other immunizations, but you only get angry when you realize this has been done to you.
Yeah.
But if you've been ill since the pandemic, consider this. And you go to your doctor, they'll give you symptomatic treatment, maybe, but realize that the reason for this can be dealt with. And when you talk about chronic illnesses several years long, 3-4 months of a treatment that you're doing every day on your own, it's fairly easy. The reason I talk about everything else, the vitamins and the leaky gut, is because if you don't do that, the cell room doesn't work to begin with.
So you're talking
Right.
about a foundational kind of treatment to get the body
Exactly.
into optimum condition.
Yeah.
And then on top of that, if you've got the extra spike proteins, you can
Simultaneously.
get rid of those.
Simultaneously.
Yeah, that makes sense to
Yeah.
me.
Because what's going to happen is the spike protein affects the mitochondrial function. You start pulling that off, plus feeding the cell and feeding the mitochondria and let it heal. Now you don't have the spike protein interfering with it. So you go from that amorphous 50% back up to 95.
Right.
Okay. And that is expressing different ways. It may be fatigue, it may be brain fog. But remember that the expression of that kind of inflammation is to be noticed. And then you use that as a outcome measure to see if you're getting better, especially when you've ruled out all the bad stuff. And that's really important. You always have to rule out the bad stuff.
Wow. Such important information. And it's so much clearer to me. I've been reading and listening to a lot of this for years, but just hearing you talk about it and also just the solutions so that people feel like they
There
have
are
hope, I
solutions.
think is so critical. I don't want anybody to feel like, oh my gosh, they're just victims of all kinds of stuff going on in the environment or in the healthcare system, etc. But we do have
This has been what's happened over time. When I started way back when, I started noticing that things weren't getting better. And I started identifying why that wasn't getting better and then developed methodologies to deal with that. And then it's just a matter of everything else on top of it. And then if you look at certain things like autoimmune diseases and so forth, if you get rid of a lot of inflammation, that should mitigate it. I'm not going to say everybody's going to be cured. I'm going to say
Right.
that things are going to get better. Okay. And you should never think that I'm broken and I'll never be fixed. That'd be the worst thing you could do to yourself.
And just that mindset is detrimental.
Yeah, it is.
And it goes into the whole emotional realm that contributes to illness. And even things like negative self-talk impact the body.
It sure does. Sure
Yeah.
does. It's interesting. I used to tell a story about an itinerant friar coming out of Europe in the Middle Ages and is on the road and meets death walking towards Europe. And they stand by and they start talking for a little bit and he asks him what he's going to do. And death says, I'm going to Europe to kill 1 million. They separate ways. A few years later, he's coming back. The friar's going back to Europe, meets death again, and asks death, you said you were going to kill 1 million. 7 million were killed. He said, I only killed 1 million. Fear killed the rest.
That is so powerful, especially with what's going on in the world these days.
Exactly. Fear
Wow, the
is
fear.
what kills. And think
Yeah.
about what's going on these days
Yeah.
that will make you fearful.
And it's designed to do that, I think, between the
Yes.
media and the politicians.
Just look at the hantavirus. The hantavirus is incredibly difficult to transmit. Okay. And last time listening to the news, and the guy saying, we're following 41 people. The thing 41 people have hantavirus.
Right.
We're following them.
Well,
But they make it
and
sound like it's the death ship.
exactly.
They're in a contained environment.
Of course, a
Where
cruise ship is like a petri dish.
Exactly. And it's like an airplane also.
Oh,
But-
that too.
I've identified people who interacted with the people from the ship and they're simply keeping an eye on them as they should. But if you listen to the experts, they're saying, calm down, calm down. This is very difficult to transmission human to human.
Right.
Yet the media is going nuts. Why? They won't read it.
Yes, of course
You
it
get good
leads.
news. You get your ratings from good news. You get ratings
That's
from
right.
bad news. This is distraction. It's out of your circle of control.
Yeah.
It may be in the outer portions of your circle of concern, but you can't do a blessed thing about it.
Exactly.
But especially with things going on now, that things change daily. with our administration and so forth,
Yeah.
it becomes very difficult for you to tell no one what truth is, what
Right.
it's going to do.
I feel
Yeah.
like every day is shock and awe. I open a tab to go to a website and I see all these
Mhm.
headlines fly by and I'm like, shit, I can't deal with all this stuff. It's like you said, it's out of my
There's
control. So much good information, Dr. Jess. Thank you. Is there
pleasure
anything
being
else you
here
want to
again.
add?
I always tell my patients, because I've been on the road for so long, that if I look nervous about something, it's time for you to jump out the window. Okay. You have to realize something, that disease is a bully.
Yeah.
You either punch it in the nose or you laugh at it. Okay. You take away its power
Yeah.
to take back your own. And that's where you have to look in the mirror and say, I'm not broken, because you're
Mhm.
not. Okay. And what I'm hopefully put forth today was there are good reasons for you to do that. To sit back and go, okay, I probably don't have to be like this.
Yeah.
I don't have to live with 17 medicines a day. Okay. And not being able to be functional. If anybody wants to talk with me, you just go to my website, drjessarmine.com.
Yep.
And down the bottom on the left-hand side, you'll see this little button that says Get Acquainted. And you can schedule a 30-minute free conference. And what we're going to do there is just chat about what the problems are. And this way I know if it's in my wheelhouse. And then we'll see if we get along with each other. Dr. Jess Armine is my YouTube channel. And I've done videos on top of videos on top of videos. And Dr. Jess Armine 724, my birthday, is my Instagram channel.
Where are you located now?
I'm in Philadelphia.
Philadelphia. But you can
I
work
have a
with people
worldwide,
telehealth.
that's all I do is telehealth. I have a worldwide practice. I have patients everywhere. It's very easy.
Excellent. Thank you so much. It's been great.
Thank
I'll
you.
probably have you back on again.
I'll be here. Big old grin on my face.